Okay, good evening, everyone. My name is Dr. Neerav Padliya. I'm Vice President of Research and Development at MYOS Technology, a medical nutrition company based in Cedar Knolls, New Jersey. Thank you so much for taking time out of your busy schedule this evening to join me for our webinar titled Muscle Health Matters for Small Animals, Improving Longevity and Quality of Life. So the way I've organized this webinar is essentially, I've organized it into two components. For the first 20 minutes or so, the first half of the webinar, I'm going to spend the time talking about background research, clinical research that has been done by researchers independent of my company, independent of MYOS, that is. To give you a good overview of the field of muscle health, sarcopenia, cachexia, and how muscle health impacts longevity. Then I'm going to spend the second half of the webinar. I will introduce my company's proprietary nutrition product, Phenotype, and then I'll spend the remaining duration of the webinar talking about research that we have sponsored as it relates to Phenotype, both veterinary research and human clinical research. So, you know, I guess the first logical place to start is by asking the question, you know, why does muscle health matter? And so this is a quote from a paper that was published by Dr. Lisa Freeman at Tufts University School of Veterinary Medicine. Although weight and muscle loss have been recognized in companion animals for many years, only recently have they become acknowledged as a common and detrimental finding. And so, you know, one of the most important reasons I would say why muscle health matters has to do with longevity. And I'm going to talk about some very important studies, both human clinical studies and veterinary clinical studies that associate the impact of muscle health on lifespan, on longevity. And so I know that, you know, the focus of our talk is on veterinary medicine and animal health, and yet I'm talking about two human clinical studies. So I like to talk about these two studies in particular, the ones from the studies that were done at Karolinska Institute in Harvard, because they're really good quality studies. They were very large studies with thousands of patients involved. And then I'll talk about these two veterinary studies, one done at ENVA in France and the other at Tufts University School of Veterinary Medicine, before I talk about research that MYOS had sponsored. Another reason beyond longevity why muscle health matters so much has to do with quality of life. So, you know, think about all of the things that you enjoy doing on the weekend, for example. Perhaps not so much right now, you know, given the situation of the world that we're in. But, you know, think about things like, you know, whether it be playing tennis or basketball or golf. You know, to enjoy all of these things, it depends on having good muscle health. And the same applies, of course, when we're talking about small companion animals like cats and dogs. Think about all of the things that, you know, you enjoy doing with your dog on the weekend, like going for a walk. I mean, that all ultimately all of that depends on having good muscle health, right? When we think about it, muscle health is very important when it comes to bone health, and there are two reasons why. One of those has to do with the biochemical crosstalk that takes place between muscle and bone. So for example, muscle produces fibroblast growth factor 2 and osteonectin, which is very important as it relates to bone health, right, and bone formation. And on the other hand, muscle also exerts biomechanical forces against bone. And those biomechanical forces that are exerted against bone by muscle are important for, in terms of bone being able to maintain its form, its shape, and its density. The other reason also has to do with energy metabolism. The fourth reason why muscle health matters so much, right? I mean, muscle is, after all, the primary glucose metabolizing engine of the body. And so it only makes sense that if muscle mass is compromised in any way, right? If we lose muscle mass, it only makes sense that that's going to lead to an elevated risk for type 2 diabetes. And that's discussed in reference number 8, this publication by Landy et al. So now for the, I'm going to spend the next 2 to 3 slides talking about the diagnosis of sarcopenia and cachexia. And, you know, when we talk about sarcopenia, we're talking about age-related muscle loss. This is muscle loss that happens very gradually, typically over the period of several decades. You know, when we're talking about humans, that is, right? I mean, sarcopenia typically it begins, you know, at the age of 40 in humans, and then it accelerates beyond the age of 60. It's also a very gradual process when we're talking about small companion animals. When we're talking about cachexia, you know, cachexia is a different ball game altogether. The muscle loss that is associated with cachexia is much more rapid. And cachexia is almost always associated with some very serious underlying disease. Typically, you know, cancer or COPD or AIDS are some examples of conditions, serious conditions that are associated with cachexia. So the human diagnosis of cachexia almost always includes unintended weight loss, and typically that unintended weight loss is usually greater than 5% over a period of 12 months. And along with that unintended weight loss, there is almost always some combination of decreased muscle strength, fatigue, anorexia, low fat-free mass index, along with abnormal biochemistry. And most often that abnormal biochemistry involves upregulation of inflammatory cytokines. Some examples, typical examples would be TNF-alpha, C-reactive protein, IL-6, for example. Now, in veterinary medicine, the diagnosis of sarcopenia and cachexia is a bit different. It tends to focus more so on muscle loss, not so much on weight loss. And as you know, being that you know you're all veterinarians, inflammatory cytokines for cats and dogs are not measured on a routine basis. Assessing muscle strength is difficult. You know, grip strength, of course, is not possible. But the use of the 6-minute walk test, though, has been reported and it has been published, and I will discuss that. And the muscle condition score is relied upon to a significant degree in the veterinary clinical setting. So this is a chart that you know has been provided by the World Small Animal Veterinary Association that has to do with assessing muscle condition score, and I'm sure that all of you have plenty of experience with this, you know. And on the right-hand side is a photograph of a dog who, unfortunately, you know, as you can tell, looking at this photograph, is very ill. This is a dog that is suffering from advanced cardiac cachexia, and you know, it's apparent just looking at this photo that the muscle loss that this dog is experiencing most likely would fall in the severe muscle loss category, looking at this chart on the left-hand side. I had mentioned in one of my earlier slides that The 6-minute walk test has been used in dogs, you know, as a metric for muscle performance. And so, you know, if we look at this chart here from a study that was published in the Journal of Veterinary Internal Medicine, we can see here that the dogs that were healthy, on average, were able to walk a distance of about 523 meters over a 6-minute period. And then if we compare that with dogs that were affected, they were able to walk about 30% less the distance that these dogs were able to walk, roughly, you know, an average of about 385 meters versus 523 meters. So the first study that I want to talk about in some detail is a study that was a human clinical trial that was conducted at the Karolinska Institute in Stockholm, Sweden. And the purpose of this clinical study was to examine the association between muscular strength and mortality from all causes. And along with that, to do some subset analysis related to cardiovascular disease and cancer in men. This was a prospective cohort study. It involved 8,762 men between 20 to 80 years of age. And the study period follow-up was also very long, which is another reason why I like this study, and I like to talk about it. You know, the average follow-up period was 18.9 years. The key outcome measures were all-cause mortality up to the 31st of December of 2003. And along with that was muscular strength, which was measured by a 1 repetition maximal measures for leg presses and bench presses. So this is a table that was taken from this paper. And as you can see, there is a lot of data on this table, but I want you to just focus your attention to the area that I've highlighted with this red box. And so the researchers, when they looked at these men, they stratified them into 3 groups. They looked at men that were in the lower third in terms of muscular strength. They looked at men that were in the middle 1/3 in terms of muscular strength. Okay, and they looked at that men that were in the upper 1/3 in terms of their muscular strength. And what you can see when we look at mortality rate here is that mortality rate was about 50% higher for the men that were in the lower 1/3 of muscular strength when compared with men that were in the middle and in the upper 1/3 in terms of muscular strength. So that trend is apparent looking here. And now if we look at men that died of cardiovascular disease, if we look at men that were in the lower 1/3 of muscular strength, their mortality rate was almost double the mortality rate of their peers that were in the middle and upper thirds as it relates to muscular strength. When we look at cancer and we look at men in the lowest third of muscular strength, we see, as we did over here, that mortality rate was about 50% higher when compared with men that were in the middle and upper thirds of muscular strength. So this first study that I talked about just now was a study focused exclusively on men. So now I'm going to talk about a study that was focused exclusively on women. And so this is a study that was done at Harvard Medical School and Brigham and Women's Hospital. And it focused on women with non-metastatic breast cancer. And the investigators, they sought to answer the question, are sarcopenia, poor muscle quality, and excess adiposity at diagnosis associated with overall mortality in patients with non-metastatic breast cancer? So this was an observational study of 3,241 women with non-metastatic breast cancer. They were women that were diagnosed between January of 2000 and December of 2013. And at the time of breast cancer diagnosis, CT was performed. And using CT, these women were placed into different buckets. One was the sarcopenia bucket, another was poor muscle quality, and another was excess adiposity. And the main outcome measures here were overall survival time and all-cause mortality. So once again, I'm displaying a table here with a lot of numbers, but I really would just like you to focus on what I've highlighted here in the red box. And so if we start off and we use as our reference women that were non-sarcopenic and had low total adipose tissue, and now we compare them with their counterparts who were sarcopenic and had low total adipose tissue, we see that these women had a hazard ratio that was 35% higher when compared with their peers, okay, that were not sarcopenic, as we go from 1 to 1.35. Now looking at women that were non-sarcopenic and that were in the middle in terms of total adipose tissue, we go from a hazard ratio of 1.28 when we compare them with their peers that were sarcopenic and also were in the middle in terms of total adipose tissue. And finally, when we look at non-sarcopenic women with high total adipose tissue, we go from a hazard ratio of 1.45 to a hazard ratio of 2.05 when we look at women that were sarcopenic in comparison and also had high total adipose tissue. Now, when we look at the figure on the right-hand side, this is a Kaplan-Meier plot. And as you can see, it's clear as day that women that were not sarcopenic had much higher 5-year survival and 10-year survival when compared with their peers that were sarcopenic, as shown over here. So now I'm going to start talking about veterinary studies, okay? And so I'm going to talk about a study that was published by a group in France at ENVA. So this was published in the American Journal of Veterinary Research, and the researchers were interested in this phenotype that they refer to as the frailty-related phenotype, okay? And so what is the frailty-related phenotype? According to the way it was defined by these researchers, there are 5 components, and these 5 components are chronic undernutrition, exhaustion, low physical activity level, poor mobility, and weakness. And so what the researchers at the National School of Veterinary Medicine in Alfred, France wanted to study was they wanted to look at the impact that different components of the frailty-related phenotype have on mortality in dogs. And so they wanted to compare dogs that displayed only 1 out of 5 of these FRP components that I just talked about, and compare those with dogs that displayed 2 or more FRP components in terms of survival time following a clinical geriatric assessment, or a CGA. And so the researchers studied 116 aged neutered guide dogs that were followed after CGA, and so 58 of these dogs were male and 58 of them were females, and they were comprised of golden retrievers, Labrador retrievers, and golden retriever Labrador retriever crossbreeds born between 1995 and 2002. These were dogs that were obtained from the Parisian School of Guide Dogs for blind or visually impaired people. And the primary outcome measure here was time from CGA to death. So when we look at this Kaplan-Meier plot, the solid line here represents dogs that had either 0 or 1 FRP component at the time of their CGA. And this dotted line or dashed line here represents dogs that had 2 or more FRP components at the time of CGA. And it's clear as day that, you know, the dogs that had 1 or 0 FRP components had a much better survival rate relative to their peers that had 2 or more FRP components, looking at this Kaplan-Meier plot on the left-hand side. Now, the other study that I want to talk about was a study that was done at Tufts University School of Veterinary Medicine. And that study was focused on body condition and the impact of body condition on survival in dogs with chronic heart failure. And so the researchers were interested in whether or not does body condition and changes in body weight predict the survival of dogs with heart failure. And so the researchers looked at 108 dogs with heart failure. And so their medical records were reviewed, data regarding initial body weight and body condition score was analyzed. And along with that, they looked at subsequent changes in body weight and treatment were collected. In terms of outcome measures, they looked at survival times were determined for dogs that were discharged from the hospital and lived greater than 24 hours after they were discharged. So as you can see, looking at this Kaplan-Meier plot here, the dogs that did most poorly were the dogs that were emaciated, that had just, you know, had very little muscle mass on them. And then even when we look at dogs that were underweight, these group of dogs, you know, did quite poorly. These dogs, the dogs that were underweight, they did a lot worse, for example, than dogs that were overweight. You know, when we look at this dashed line here, and that to me, I found that quite counterintuitive, and so, you know, these researchers came up with an interesting explanation. You know, they wrote that the obesity paradox is a relatively newly addressed phenomenon in cardiology. And they made this comment that one possible explanation for why we saw this may be, you know, due to the cardioprotective role of adipose tissue-derived neuroendocrine molecules that include cytokines and hormones. And so, you know, that's probably why the dogs which were obese and overweight, why those dogs, they managed to do better than dogs that were emaciated. Okay, so that concludes the first half of the webinar, where, you know, the focus was on giving you a broad overview of the field and talking about clinical studies that illustrate why, you know, muscle health is so important for both human health and canine health. And now I'm going to talk about our proprietary product, which is called Fortitropin. And then I'm going to spend the rest of the time talking about research that MYOS Corporation has sponsored related to Fortitropin, both veterinary research and human research that we sponsored. Okay. So what is Fortitropin? Fortitropin is a natural bioactive composition that is made from fertilized chicken egg yolk. It is made using a patented low temperature manufacturing process. And this process was developed by researchers at DIL, the German Institute of Food Technologies, based in Quakenbrück, Germany. And the idea is using this low temperature process, it enables us to better retain the natural bioactivity of the proteins, peptides, and lipids that are found to be naturally present in fertilized chicken egg yolk. Fortitropin has been shown to increase muscle mass and strength, to prevent muscle atrophy, and also to improve recovery. It's manufactured in modern state-of-the-art GMP facilities, and the manufacturing process is protected by 2 US patents that have been issued to MYOS Ren's technology. And along with that, we have a number of patent applications that are currently pending with the USPTO. In terms of the canine market, we have two products that are currently offered, that are on the market. One of them is MYOS Canine Muscle Formula, this product here. MYOS Canine Muscle Formula is simply comprised of a single ingredient, that being fortitropin. And along with that is this product, MYOS Canine Muscle Formula Vet Strength. So the Vet Strength product is comprised of 3 ingredients. It includes fortitropin, some branched chain amino acids, and dextrose. And so there is a very large body of literature, in the peer-reviewed literature, that talks about the beneficial properties of BCAAs as it relates to muscle health and stimulating myogenesis. The problem is that BCAAs are very bitter in terms of taste. And so in order to sweeten it a bit, some dextrose is added to that to mask the bitter taste a little bit. Now, this product is available exclusively through veterinarians that we work with. And both of these products are manufactured in modern state-of-the-art GMP facilities. So now I want to spend some time and discuss the research that is behind fortitropin, both the animal research or veterinary research, and along with that, the human clinical research. So in terms of animal research, we completed a veterinary clinical trial at Kansas State University, and I'm going to talk about this in detail and present the results from this trial. But we demonstrated that fortitropin prevents atrophy of disuse in dogs undergoing TPLO surgery, and it also helped to accelerate recovery in these dogs as well. Along with that, as far as animal research goes, we did a study in rodents to understand the mechanism of action of fortitropin. And we demonstrated in this study, which was published in 2016, that fortitropin acts by upregulating mTOR pathway activity, downregulating ubiquitin proteasome pathway activity, and lowering myostatin levels. And we have a study that's underway at Kansas State University that is examining the impact of fortitropin on quality of life and mobility in geriatric dogs. So this study is still underway. And in addition to that, there is a study that we have underway at Animal Medical Center in New York that is looking at the impact of fortitropin on serum myostatin levels over a 24-hour period. Now, in terms of human clinical research, we recently completed a randomized, double-blind, placebo-controlled human clinical trial that looked at the impact of fortitropin on the rate of muscle protein synthesis in older men and women between 60 to 75 years of age. And we demonstrated in this study that it increased the rate of muscle protein synthesis by about 15%. And so this study was completed last year, and it was recently presented at the International Conference on Frailty and Sarcopenia Research in Toulouse, France last month. Along with that, we completed a human clinical trial in 2014. The results were published in 2016. This was done at the University of Tampa, and it focused on the impact of fortitropin on muscle size, mass, and strength in 18 to 21-year-old men. This was completed and published in the Journal of the American College of Nutrition. And along with that, we also have a clinical trial that is currently underway at McMaster University in Canada. This study is focused on looking at the impact of fortitropin on the atrophy of disuse. It's known as the unilateral leg immobilization model, and this is in young men. So this study is currently underway, and essentially what this model involves is young men that participate, they have to wear a knee brace for a period of 2 weeks. And wearing that knee brace induces a significant degree of muscle atrophy. And so the idea is to see if by taking their assigned supplement before during and afterwards, during the casting period, whether or not that can slow the rate of muscle atrophy that takes place due to casting or immobilization. Okay, so now I'm going to talk in some detail about the veterinary clinical study that we sponsored at Kansas State University. So tibial plateau leveling osteotomy surgery, as all of you know, is performed to repair tears of the cranial cruciate ligament. It is one of the most common veterinary surgical procedures that's performed in the United States. And afterwards, the operated limb, as all of you know, has to be immobilized for several weeks following surgery, and that typically results in a significant degree of muscle loss. So the way the study was designed was there were 100 dogs in total. 50 dogs received fortitropin on a daily basis, and 50 dogs received a macronutrient matched placebo, which in this case was cheese powder. A series of evaluations were performed at baseline in 8 and 12 weeks following surgery. So these evaluations were thigh circumference, muscle thickness, stance analysis, and blood chemistry. And I'm going to talk about the results in detail in the subsequent slides, but the key takeaways were that fortitropin prevented muscle loss in affected and unaffected limbs. Fortitropin supplemented dogs had greater improvement in weight-bearing capacity on the operated limb, and fortitropin supplementation prevented a rise in levels of myostatin as well. So this is a slide that summarizes data from stance analysis or force plate analysis. So as all of you know, a force plate has 4 plates, typically one for each of the dog's 4 legs. And so a dog, stands on the force plate, and under normal circumstances, you would expect that the dog would be able to evenly distribute its weight on all 4 plates. So 25% of its weight on all four plates. But when one of the legs is injured, or shortly after surgery, the dog can't distribute a lot of its weight on that particular leg. And so that number is much lower than 25. And the remaining weight, gets to be, on the remaining 3 legs, gets to be somewhere, in the range of 30 to 33% in order to compensate for the reduced weight-bearing capacity on the affected limb. So here we're looking at fortitropin supplemented dogs and their affected limb versus placebo supplemented dogs. And so you can see here at baseline, we were 8% weight-bearing capacity in this group versus 9.63% weight-bearing capacity in this group. And over a period of 8 weeks, we saw an improvement of 5.74% in the fortitropin supplemented group, but the improvement that we saw in the placebo supplemented group was much smaller comparatively. It was an improvement of 3.25%. And so key conclusion is that weight-bearing capacity improved by 43.4% in the fortitropin supplemented group when compared against the placebo supplemented group. Okay, so now we're going to talk about thigh circumference. And so here in this table, we're looking at the affected and unaffected limb in the dogs that received fortitropin supplementation and comparing that with the affected and unaffected limb in dogs that received the placebo. So let's start over here with the affected limb in the fortitropin group. So over a period of 8 weeks, you can see that thigh circumference in this group dropped on average by 0.54 centimeters. Okay, but that is much lower when we compare to the drop that was experienced of 1.21 centimeters in the affected limb in the placebo supplemented group. So the placebo group experienced 2.2 times the loss in thigh circumference over here relative to the fortitropin group. Now, when we look at the unaffected limb in the fortitropin supplemented group, over an 8-week period during that recovery period after surgery, we see a loss of 0.71 centimeters in this group. But the loss is almost 3 times higher in the placebo supplemented group, where we have a drop of minus 2.04 centimeters, going from 36.3 centimeters to 34.26 centimeters. And so now we look at myostatin levels while recovering from TPLO surgery. And we look at fortitropin supplemented dogs, and we see that going from week 0 to week 8, the mean increase was 45.1 picograms per ml per week. So this was not statistically significant. The p-value was very high at 0.66. But on the other hand, when we look at placebo supplemented dogs, we see the p-value was significant at 0.02, and we see that there was a very significant increase in myostatin. The increase in myostatin was 8 times higher, at 358.9 picograms per ml per week. And so, as all of you will recall, myostatin is a protein that effectively puts the brakes on the growth and development of new muscle tissue. And so this increase that we see in myostatin in the placebo group is a bad thing. That is telling us that processes, biochemical processes are happening to halt the development of new muscle tissue, while there is a degree of protection that is afforded in the fortitropin supplemented group over here. So now we look at the impact of fortitropin on older adults. So this is a human clinical study that was done at University of California at Berkeley. And it was a randomized, double-blind, placebo-controlled study, which took place over a 21-day period. It involved 20 subjects, 10 men and 10 women. So there were 5 men and 5 women that received fortitropin, and 5 men and 5 women that received the placebo. And they were all 60 to 75 years of age. So the idea is that all of the subjects had to consume a deuterium oxide tracer every day of the study. And the idea is that, eventually the deuterons from the deuterium oxide are incorporated into all of the amino acids that are synthesized throughout the body. And eventually these amino acids get incorporated into all of the proteins that are synthesized in the body, as we have, continuous turnover of proteins. And at the end of the 21-day period, a muscle microbiopsy is performed, and muscle tissue is isolated and collected. Protein is extracted from the muscle tissue that's obtained from the muscle microbiopsy. That protein is digested with trypsin, and this complex mixture of peptides are analyzed using high-resolution mass spectrometry. And using high-resolution mass spectrometry, it's possible to very accurately measure the incorporation of deuterium in all of the proteins that are obtained from the muscle microbiopsy. And so if there is greater stimulation of muscle protein synthesis, then one would expect that there should be greater incorporation of deuterium, right? Because the muscle protein is turning over at a greater rate. There is greater muscle protein synthesis and hence greater incorporation of deuterium. And so the amount of deuterium that is analyzed in the muscle tissue can tell us something about the rate of muscle protein synthesis. It's directly proportional to the rate of muscle protein synthesis. And so that is the whole idea of this workflow that was developed to measure the MPS rate. So as you can see, looking at this, this chart, on the x-axis, we have 38 myofibril proteins listed, which were observed in both the control and the fortitropin groups. And on the left-hand side, we have a measure of their fractional synthesis. The blue bars, as you can see, correspond to cheese powder, and the orange bars correspond to fortitropin. And we can see that the overall magnitude of increase was approximately 15% in the fortitropin supplemented group when compared with the cheese powder supplemented group. So there was a significant increase in muscle protein synthesis rate afforded by the group that received fortitropin here, as you can see. So now this is data from a clinical study that was published back in 2016. It was done at the University of Tampa. It was a randomized, double-blind, placebo-controlled human clinical trial involving approximately 45 men between 18 to 21 years of age over a period of 12 weeks. During this 12-week period, the men that participated in the study, they had to perform resistance training twice per week. And they had to work very closely with a dietitian who recommended and monitored their diet over the course of the clinical study. So there were 45 males in the study, as I mentioned. 15 of them received the placebo. 15 of them received a single dose per day of fortitropin. And the remaining 15 received a triple dose, that being 19.8 grams per day of fortitropin. And as you can see here, the change that was observed in the placebo group in terms of lean body mass and muscle thickness was not statistically significant in the placebo group. On the other hand, we did see statistically significant changes in lean body mass and muscle thickness in the groups that received both a single dose and triple dose of fortitropin, as you can see here. So I just want to summarize in this table here all of the veterinary research that has been completed or that is underway presently. I talked about the study that we did on recovery following TPLO surgery that was done in the laboratory of Professor Ken Harkin at Kansas State University. So this study has been completed. A paper based on this study has been submitted for publication to PLOS One, and revisions have been made to the manuscript, and we're currently waiting for this the revised manuscript to be published. We have a study that's also underway at Kansas State that's looking at the impact of fortitropin on the quality of life and mobility in geriatric dogs. That study is still underway. And along with that, we have a study that is currently underway by Dr. Leilani Alvarez, who is at Animal Medical Center in New York. And the focus of that study is the impact of fortitropin on serum myostatin levels over the period of 24 hours. So just want to summarize here, that fortitropin is an advanced nutrition product for muscle health. It's been clinically shown to be as an all-natural nutrition product that promotes muscle health in dogs. In the veterinary clinical trial that I talked about at Kansas State, it was shown that fortitropin helped to reduce muscle atrophy following TPLO surgery. And along with that, it also helped to accelerate recovery time following TPLO surgery. Now, it's also important to note that 80% of dogs with CCL tears in the United States, they do not receive surgery for a number of reasons. One of those major reasons probably has to do with cost of the surgery. And these dogs, we believe, may significantly benefit as well. It may help to strengthen the muscles, for example. Along with that, now we have not studied dogs with hip dysplasia, but we think that it's quite possible that these dogs may also benefit from the product. It may help with building collateral muscle support, which would be important for the affected coxofemoral joints. And so to summarize, as I had talked about at length earlier, it's very clear from published research that muscle health is very important as it relates to longevity. And we also believe that gaining muscle mass will help dogs enjoy a very active and healthy lifestyle. And so that concludes the presentation for this evening. Once again, I'd like to thank you for taking time out of your busy schedule this evening to join me for this webinar. We're going to have a brief Q&A session now, and I'll be very happy to take any questions that you have right now once we start the Q&A session. If you think of any additional questions that you have, feel free to send me an email. If there are technical questions, to this email address, npadliya@myoscorp.com. If you have questions related to business development, related issues, related to pricing or product availability, feel free to reach out to my colleagues, either Andrea Libretti at alibretti@myoscorp.com or Mike Solano at msolano@myoscorp.com. You can also call us at our office at 973-509-0444, okay? And we'll begin the Q&A. So looks like we don't have any open questions as of right now. So I will stay on the line for about 2 minutes, see if any questions come up. If there are no questions that come up after 2 minutes, then we'll conclude the webinar. If not, I'll be happy to stay for as long as necessary to answer all of your questions. All right, we have a question here, which is, what would be the time frame of benefit in muscle development? So, I can only answer based on the data from the studies that we've conducted. In the study that we did at Kansas State University, we saw a benefit. I showed data after 8 weeks. So there was a benefit after an 8-week period. In the human clinical trial that I talked about at UC Berkeley, we did see a significant impact on the rate of muscle protein synthesis after 21 days, but that was a human study. We have received many anecdotal reports from a number of our customers who have told us that they have seen significant improvements related to mobility in their dogs after a period of about 3 to 4 weeks. But those are anecdotal reports. So. Okay, any other questions? I'll stay for another minute or so, and if not, if there are no other questions after about a minute, then I'll conclude the webinar for this evening. Okay, looks like we don't have any more questions. So thank you once again, all of you, for joining me this evening. And feel free to reach out to me by email or to my colleagues, Andrea and Mike. And I hope you have a great evening. Enjoy the rest of your evening and stay safe. Take care. Bye.